almost there.
Oh, I thought you said we were. Okay. Well, we're about to be.
Thank you, Chair. We're live.
Yeah, let's vote on that.
Yeah, please.
Good morning, everybody, and welcome. It is Wednesday, August 24th, 2022. It is exactly 10 a.m. and this is the weekly public business meeting for the Lincoln County Board of Commissioners. Welcome to everyone who is present here in the Commissioners Conference Room at the courthouse, and also welcome to the people who are on our Zoom call. These meetings are broadcast live on the county's YouTube channel and recorded and are made available on our website as well. We have all three commissioners present, and that constitutes a quorum. Next up, recognition and proclamation. And we want to recognize several county employees for work above and beyond the call of duty in the Veteran Stand Down for 2022, which recently took place. For folks who aren't familiar with the concept of the stand down, I believe this actually dates back to the Vietnam War, when the military would hold events to point veterans, newly exiting the service with various resources to help them make the transition back to civilian life. And in recent years, it's become a concept to assist all veterans in need, regardless of their status of service or their time away from the service. So we have individual letters to several key people, and I would ask, because I call your name, letters of thanks and recognition. Keith Barnes, our Veteran Service Officer, who did an awful lot of work in making this happen. And unfortunately, because of COVID-19, could not attend the event, but would you mind standing over there? I think it's a tribute to Keith's leadership and hard work that things went as smoothly as it did.
Slacking on my job.
Oh, okay.
And we're
Yes,
not asking
Commissioner.
Keith to stand over there because of COVID, but for a
Yeah,
picture in a few moments.
Caroline, I'm sorry, your last name is still a mouthful for me. Caroline Kay, okay. Then we have Lori Grove, also on the office staff. And we have one employee who unfortunately could not be here today, Nan Buck, who is in human resources for the county, and also, I understand, played a significant role in making the event happen. You know, Nan is one of those mostly unsung people who not only carrying out her job and carrying it out well as part of her daily routine, but she is so often giving of her time for extra projects like this. So thanks to y'all. Yes, let's get the whole board. Close enough together.
This is great. Okay. All right. 3, 2, 1. 3, 2, 1. Well done. Thank you.
Yes, if I could make,
Yeah.
just.
I'm not gonna say thank you until I see the picture.
You guys.
Real
Mr.
quick-
Barnes.
Yeah.
Real quick, Keith Barnes, County BSO. I wanted to give a big shout out to a couple people, especially Caroline and Lori. As it was said, I got COVID on the week of the event, and that was kind of a downer for me. I also want to say thank you to Mr. Johnson coming in and helping with some of the administration, so that we did have somebody there covering, could make decisions for the county. So I want to say that. And a really special shout out to our community partners, Josh Yearly for WorkSource Oregon, and Kyle Hatch with Samaritan. He's the Veteran Service Coordinator for them. Kind of a conglomerate of things happened that week, where Kyle ended up being out for the week because of a personal emergency and me getting sick, which left it on to Josh to kind of run the whole thing. And I really think it's important that we shout out to our community partners there. And I want to thank the board for the continued support for our office.
You're welcome. And about how many veterans did you serve on this day?
We had 67 come through.
Excellent.
Total, I think we had 4 that were identified as houseless and reached out and received additional services at that time. We had many more that were in that verge area between, housing security and unsecurity that were able to reach out and meet with some of our community partners and start receiving those services. So overall, it was a very successful event.
Good job again.
So
Thanks.
if I may,
Commissioner Hunt.
there are a variety of different services that the veterans can access at this event. You mentioned representation from WorkSource and Samaritan Health, but I believe there are other services that can be accessed. Maybe you could share those with our audience.
Absolutely. So we also had the CSC out there, which works through the county, the COG.
Mhm.
I lose what the acronyms stand for, that work with our SSVS, Support Services for Veterans and Families. We also had VA proper there. We had several groups from the VA Houseless Homeless Veterans Program. We also had tie with another housing for, they provide what word am I looking for? They provide some resources for the near homeless veterans. And then, of course, we had WorkSource out there. We had our office and a few others that were part of it. Tools for Vets was there. And we had the Samaritan Health Van was there. So veterans could go in and see things for acute issues that they're having. I believe they're also giving COVID shots. We had the VA mental health van out there, which reaches out to veterans who are in crisis or near crisis at that time. They can provide some services. We didn't have the dental van. That's a sore subject. We're working through that.
No pun intended. Huh?
No pun intended. There's a little pun intended.
Mhm.
And we had the gear handout, which was providing veterans with homeless veterans, especially with cold weather and gear to get them through the winter time.
Outstanding.
Very
Mhm.
good.
Yeah.
And I'll just take a moment to say I thank you and I thank all veterans for their service to our country. It's deeply appreciated.
Thank you. I appreciate that.
Yeah,
Thanks, Keith.
I would just add that I did get to attend the event, so I was glad I was there. And we also had a lot of county employees that were in attendance that were also veterans. So it's nice to see them there as well. And just a question to you, Keith, you had mentioned Josh from WorkSource Oregon and then Kyle Hatch from Samaritan. We obviously are recognizing county employees today, but should we maybe send those two partners a kind of formal thank you letter? I see people nodding in the background. So
I'm
you agreeable to that?
I'm agreeable to
Okay.
that.
All right, we can do that.
I have thanked them through their supervisors, but I
Okay.
will write something official and send it out to you guys.
Yeah, I think that would
Okay.
be great. We can have Callie or Chelsea follow up, but maybe if you get us their, contact information or address or whatever, we can do that.
So would there
Okay.
be others that were there representing other organizations? I don't want to exclude. I
Oh, yeah.
certainly support the idea, but I guess I would ask you for a list of all individuals that you think it would be appropriate to receive a letter of appreciation.
I think that the core group, which was Kyle, Josh, and actually Caroline was my representative on that group. They were really the ones that put this whole project
Okay.
together. The other ones are kind of like vendors.
Okay.
Even though they're important, they weren't in that administration portion. So I think a letter to those two would be great, and would suffice for what we need.
Sounds good.
Sounds like
Yeah,
everyone's
good
agreeable.
idea.
Okay.
Thank you.
Thanks very much.
Thank you. And
Thank
again,
you.
thank you guys for your support.
Thank you.
Yeah.
You bet. We move on now to the adoption of the consent calendar. These are routine items or items discussed at previous meetings. Are there any consent calendar items that either staff or commissioners wish to highlight or remove from the consent calendar?
I just want to do a shout out under H2, State of Oregon Coronavirus State Fiscal Recovery Fund, SR 2241, well repair. This is actually one of my projects, and this is money for the Otis area for wildfire recovery to finish inspection and repair of wells that were damaged in the Echo Mountain fire. So this funding was actually granted to Lincoln County about 18 months ago, and it is a happy day that we are finally able to execute this contract. Other than that, I'll make a motion to adopt the consent calendar as presented.
I'll second it.
We have a motion and a second to approve the consent calendar. All in favor, please say aye.
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 It's approved. And we move on now to our discussion and information items. And first up, a discussion on an intergovernmental agreement, US 101 Mooloc landslide repair. And Mr. Kenyon, introduce yourselves and yourself and introduce the issue, please.
Good morning to commissioners. I am the one, Roy Kenyon, Lincoln County Public Works Director.
Roy, the one and only.
One and only. Good morning. Lincoln County has been approached by the Oregon Department of Transportation to basically give them permission to utilize one of our county road right-of-ways for basically this Mooloc Slide repair project. Mooloc Slide, as you probably all well know, because you drive over it quite often, is out there north of Agate Beach. It is an historic slide area. And what ODOT has found is that east of the highway, there is what they call a sag pond. And it was created by continued movement of the land over a long period of time. And what it does is it actually collects water. And their fear is that that collection of water is actually saturating the subsurface, and it's leading to the movement of Highway 101 at that point. Lincoln County actually has a county road there, which is 89th Court, which originally was part of the original Highway 101. And when the new stretch of highway was built, it was jurisdictionally transferred to Lincoln County. It's a dead end portion of road that is approximately, well, somewhere between 1.25 mile long. So it's a dead end road. It serves two residents. So they approached us with this agreement to enter into agreement with ODOT to allow them to occupy our right of way. What they're going to do is they're going to put in a drainage system to basically keep this sag pond drained empty. And so it'll run from the sag pond north along 89th Court down to Mooloc Creek and then out to the beach. The water that is currently in the sag pond, they're actually going to be removing from the area. It actually tested out with a higher than acceptable iron content, which is not that surprising since that area is known as Iron Mountain, and there's a reason for that. And so they're going to pump the water out, filter it, and then remove it from the area. And so the water that will be running through this system will be whatever is collected after that time. So if there is any groundwater that's collected, it'll run out, and anything that attempts to collect during any of our rainstorms during the winter will also run out. And so basically it's an attempt to try to dry out the area. If you choose to sign the agreement, Lincoln County, as part of the agreement, has already put the responsibility of maintenance of the system on ODOT, and they have agreed to do so. So there will be no cost to Lincoln County for the install or for the ongoing maintenance. It'll only be occupying our right of way.
So they would take over maintenance in perpetuity?
Yes,
As part
for
of
the
the-
for the life of
Oh,
the
for the
facility.
life of the project.
For the life of the facility. So
Okay.
once the facility is actually in, they will be responsible for the maintenance of that facility
Okay.
until the time that they either feel that it's no longer necessary or it is actually outdated by some other project. And so basically, we will still retain the right of way. It'll still be our county road. And as part of the project, they've also agreed to resurface the road with asphalt. So out of this, we get new asphalt on the road.
During the installation, will access to the two homes served by the road be blocked or impaired?
We are in the process of permitting this project within our right of way. And as
Mhm.
part of that, they will be required to provide access to those residences. So there may be one of those 20-minute delay, half an hour delay things, or a longer delay upon notice. But no, access to those residents will not be permanently blocked or blocked for an extended period.
All right. Anything else, Mr. Kenyon?
No, although they did say that this was possibly phase one of multiple phases, but they're not really sure what phase two and phase three actually are going to be, nor do they know where the funding is going to come from. And I think it's really totally dependent upon how successful phase one is. If phase one is successful, then it may be the only phase. If phase one is only slightly successful, then they probably will have to seek, further projects to try to slow this thing down.
Okay, do my fellow commissioners have questions for Mr. Kenyon?
You asked my biggest one, which was just access for property owners, but my other one is, what's the anticipated life of the project? Do they know?
The drainage facility
Yeah.
itself.
I mean,
Well,
so another way to ask it is, how long are basically they anticipating using this right away?
well, they will probably be in the right of way for something that would probably exceed 20 years.
Got it. Okay.
Back in the day when we used metal corrugated pipe that close to the beach, I'd say that the life of the project was about 5 years. But now that everything's gone to basic plastic, it's quadrupled the life of any drainage facility. So I don't think there's ever going to be an intent to remove it. They may actually at some point in time have to repair it, but it's probably going to be there for ever.
Yeah,
Yes.
because MULAC is an ongoing slide
That
problem.
whole
Yeah.
area, as we all know.
Yeah.
Yes, and if you've been here long enough, you've heard stories about them wanting to actually reroute that whole stretch going back east. And I get those rumors are still floating around, but there's rumors at this time.
Okay. All right. Thanks. Those are all my questions.
Okay, Commissioner Hunt?
I have a couple of questions, and I guess my number one question's already been answered. This project isn't going to be any long-term or significant inconvenience to the two residents that utilize that road.
I don't believe so. It's actually a fairly straightforward project. It's basically just trenching and laying pipe. And so in the area of the driveways and then further north to get out of there, we're only probably looking at maybe a week of work in that area. And so it would be possibly bothersome for a short period of time.
Okay. I guess my memory doesn't remember this type of an intergovernmental agreement with ODOT. Is this unique? Are there's others that I simply forgot?
We actually entered into an intergovernmental agreement with ODOT in 2018 or 19 to do similar work up at Beverly Beach.
Okay.
There was a large pond retainage area off of Beverly Beach Drive. And it ran underneath Beverly Beach Drive, down across private property, and then down and actually ended up going out Beverly Beach State Park and into the creek there. And we actually entered into agreement at that time to do a drainage project similar to this, but it was slightly different because at that time we had agreed to take on partial maintenance of the system because it crossed, because really it was our culvert that they were replacing, one that we normally maintain. And then it actually ran down within our right of way that actually benefited the county. And as that part, they agreed to install the drainage facility, but we agreed to maintain the section of that facility that was within our right of way because it was a direct benefit to Lincoln County Road Department. In this case, even though it's benefit to the public, especially if it's successful, it does not directly benefit Lincoln County Road Department. Therefore, we did not agree to participate in the long-term maintenance of it, but we would like to grant them permission to occupy our right of way.
Okay. Last question. You talked about the high iron content in the water. Will that not be an issue if the water is able to run off directly through
Actually,
this system?
No, because they actually have tested the groundwater in the area. And it does not show that high of iron content. So the iron content in the current water basically is there because it's sat so long.
Okay.
Yes, and we actually asked for the DEQ report for that, and they said that because of the level of iron in the water, it did not exceed the DEQ report's level, but we do have the water quality report, and I think it's actually included in the packet that was sent.
Will there be any future testing, periodically of the water and the runoff?
I asked that question, and they said most likely not, only because that what they're predicting is it's only going to be fresh water that runs through it.
That's all the questions I have. Thank you.
All right, then what's the board consensus? Do we want to ask staff to prepare an order and bring that back for decision next week?
Yeah, I'm okay with that.
Yeah, I'm
Does that
fine
meet
with
the
that.
timeline?
All
for
right.
that?
Thank you, Mr.
Yeah.
Kenyon.
Yeah, ODOT is, they're wanting to get started on this, but I think that would be
Okay,
adequate.
okay.
Okay,
thanks.
great. Thank you.
Thank you.
Okay, next agenda item is a discussion on a possible extension of the moratorium for short-term rental licenses. And County Council Yule, would you please remind us, when does the current moratorium expire?
Good morning, Commissioners. Kristen Yule, County Councils. The current moratorium is set to expire on September 6, 2022.
Okay, so I think there's a two-part question before us today.
Actually, can I
Oh, sure.
pause for a minute?
Yeah.
Council Yule, can you just kind of put on your educator hat for a minute and just kind of give some bullet points on what this is? There's so many different STR pieces, and I just want to make sure people listening or whatever understand what this moratorium is, that it's not the ballot measure, et cetera. Can you just kind of give a bullet point of what the moratorium is?
The current moratorium in place doesn't allow any new licenses to be issued except for rural residential locations. And so the sheriff's office was not accepting, and that was in line with what actually the language of the ballot measure was, which said no new licenses in R1, R2, or R1A, except for rural residential. So the decision before you is to determine if you want to extend or issue a new moratorium, if you want the moratorium to lapse, and you will have the sheriff's office process new license applications. So those are the two discussion points.
Thank you.
Yeah, and then I think depending on the direction of the board, we've got a possible third discussion point was if we do support an extension, how long that extension should be.
Well, also, I think the reason behind the moratorium was to limit or prohibit new licenses on new STRs. And unless the ballot measure is implemented, which is not likely to happen in view of the decision by LUBA, or our proposed ordinance 536,
523.
So
520.
ordinance 523 became law in January of this year. It went into effect 90 days after you approved it. It's been administratively on hold due to the litigation with the ballot measure, which conflicts a lot with 523. I think the recent decision by LUBA cleared up obviously those conflicts. So 523 is lawful, is valid. It is being litigated. There are some appeals in circuit court. If you have questions about.
I guess what I was trying to say is the reason for the moratorium is to have a resolution as to the litigation involving 523. And without the moratorium, what would happen?
So 523 designates 7 geographical areas, which you make a decision, the commissioners make a decision on if you want to cap percentages for certain areas of licenses. And so that is a decision that will need to be made down the road, designating caps and making a decision as to those license numbers for each area.
Okay, so by continuing the moratorium, it allows time to address some of these operational issues relative to 526, 23.
523, yes.
Sorry. Okay. I think it's helpful to understand why the moratorium, in my opinion, should be continued.
Yeah, I would just add, I'm supportive of extending that because I don't think we're ready to have, 523 fully executed by the 6th of September. And we didn't execute because we were waiting to see what was happening with the ballot measure. And now that we know that cannot legally be implemented, we need to turn our attention to 523, but we're not going to be fully executed on that by the 6th of September. So I definitely support extending that moratorium, somewhere between 3 to 6 months. I think that's would give us enough time, but I guess I'd kind of like to hear from, maybe the sheriff's office and planning on how much time they think they need to have those pieces ready. Because, I'd rather only extend this one time and not have to come back and extend it again, because we're not ready to implement yet. So I don't know if you want to come up yeah.
Well, while the sheriff and I don't know, deputy, lieutenant, Lisa, director are coming forward, I think for the exact reason that you just mentioned, Commissioner Jacobson, I think there's value in extending this for a longer rather than a shorter period of time. And it's also a fact that should these operational issues be resolved, the moratorium could be repealed and then ordinance 523 implemented.
Yeah,
So
yeah, good, excellent point. Yeah.
I would favor a longer moratorium rather than a shorter one.
And just for the record, I will say I favor an extension of the moratorium as well, and lean toward what Commissioner Hunt has said about a longer one. So, Sheriff.
Curtis Landers, Lincoln County Sheriff.
Lisa Combs, Support Services Director for the Sheriff's Office.
I'll turn over to you to begin with. You're the expert on what is all involved in this.
Okay. So the current moratorium was created to basically go in line with the measure. So you set a moratorium on R1, R1A, and R2. So if you extend it with those same guidelines, then we're still going to accept applications outside of those. So that's something to think about because we have been issuing licenses. So if you want to cap in certain areas, we're adding to your cap. Things to think about as we're moving forward would be, if you want to cap, are you doing it on a percentage? I believe prior council Belmont put together some documents, which we all still have, all needs to be formalized. We've got to notify owners of new restrictions on occupancy. We need to notify them of some tighter restrictions on, they have a tendency sometimes to forget to renew longer than 30 days or 60 days. And so 523 basically tells them if you go longer than 30 days without renewing your license timely, it's an automatic revocation and they would have to do a new license. So there is quite a bit of information we need to get out. I'm sure that the owners have probably got their reservations set for a period of time. So we need to be thinking about how long are we going to let them operate outside of 523. Planning is going to have probably the bigger adjustment than the sheriff's office is. We probably can get notices and letters out to owners relatively quickly. Since this is going to be new to planning with all this septic language, they probably need a little bit more time than we do.
Thank you.
Yes,
Yeah.
and we also have researched do you want to look at doing a lottery type situation for when licenses come open and they're available to be issued again in a certain location? Do you want to do a lottery type selection, or do you want to go first come, first serve? So another couple things to think think about.
I'm sorry, was it lottery or what?
We talked about it quite some time ago, whether or not when you've got a capped area and you have openings,
All right.
do you want to do first come, first serve?
Okay.
So the people that
Go
got their
wait list.
applications in
Yeah.
first.
Or a lottery.
Or random lottery.
Okay.
Yeah, so I'm thinking today we make a decision on the moratorium and, both sheriff's staff and planning staff will need some lead time to gear up for implementing these provisions of 523. Perhaps we could ask for a report back on that later and then kind of firm up a path toward implementing our measure.
I have a couple of additional questions.
Uh-huh.
One is Ano happen to be on, Casey?
Oh, no.
Okay, well, never mind on that one. And I guess the other thing I was gonna bring up is something that Lisa had said about, our current moratorium does allow, still accepts applications outside of R1, R1A and R2. So I'm assuming that's rural residential mostly, yeah. Or TC or AC maybe. So we're still accepting those applications. And I guess when I think about implementing 523, because this current version of the moratorium was more about trying to sort of be in line with the ballot measure. And when I think about trying to line ourselves up into 523, we may, not want to extend the current moratorium as is, but maybe not accept licenses in any of those areas, because if we're accepting licenses in rural residential, we could be setting ourselves up later to be getting, higher than maybe that percentage we want, only to have to come back down later. Does that make sense? Okay.
Mhm.
And Commissioner, you could request numbers from Ms. Combs on how many we have. in
Oh, yeah.
rural Residential.
Thank you. Great
Yeah,
idea.
like
Ms.
maybe-
Combs, how many numbers have we
Well,
gotten?
she
I
loves
get- yeah.
And maybe,
Yeah.
and then how many?
Thank you,
since-
Counselor. That was my question.
Yes, and also
How
I think,
many have we had in for the RR zoning?
Off the top of my head, I don't know, but I would say it's probably close to 70% of the short-term rentals, and we've got about 511.
oh, really? Wow.
Whoa,
I
whoa,
wouldn't have
so
imagined it
so
would
you're,
be.
you think about, this is just a guess, but you think about 70% of our current short-term rentals are RR.
I'm guessing,
No, what's the number?
No.
Applications, you mean?
I don't know
Yeah.
Well,
how many of our current
That's for-
active properties,
Mhm.
but it's a huge amount. It's well over half, I would say.
Or
Are in the RR or in the R1,
Oh, okay.
R1A.
Right.
Oh,
Yeah.
did I misunderstand?
Yes,
Yeah.
yes.
Oh,
Same in the rural.
Oh, okay,
Okay.
so.
You gave me a heart attack, Lisa. Yeah,
No,
okay.
no, it's more like
Very
the
small.
30%. It is a
30%, yeah, it's
smaller
the other
percentage.
Mhm.
Sorry, I misunderstood that.
Okay.
Okay.
How many, with our current moratorium, how many new licenses, which would be RR, have we gotten in this current moratorium? How many new
Not
licenses?
very many.
Okay,
Yeah,
Right.
that's
okay.
what I would have
I
assumed.
think that's the important point.
Yeah.
So if I may clarify. Well, the current moratorium allows for new licenses in our on properties in our zoning. It doesn't allow for new licenses in the other R1, R.
And there's not
Other
that many
residential
coming in,
properties.
and there's not
So-
that many coming in.
Within the currently permitted areas, we've issued
Very few,
a handful of new licenses.
right?
And that's
Okay.
over how long?
I don't know how long have we been doing this?
The-
It's
Since the
COVID.
moratorium was in place?
At measure since the.
yeah, because our
Yeah.
moratorium changed.
Mhm.
Yeah,
Yeah, that's right. It
Mhm.
changed from none to allowing RRs. Okay,
And I
well,
think the idea of the ballot measure and your ordinance was to push those
right.
houses back out there, if I may. So, maybe just in my opinion, keeping those open helps people want to have a short-term rental. They have an opportunity, place to do that. And again, I think the whole objective of the measure and the ordinance,
Mhm.
just my opinion.
And one other comment, as I was looking at the draft regions as that was put together by the surveyor's office on our behalf from May of 2021, it indicated we had 532 short-term rentals active, and right now we only are at about 511. So we're not going above, we're not
Mhm.
going
The
up.
numbers are still going down.
Can you say that number again? We're currently at 511. What were we?
We're currently at 511, and it had been 532 in May of 2021 when we were working on those draft sub areas.
Yeah, and I think when Commissioner Hall and I put in the moratorium, I think Commissioner Hunt was an excused absence 2 years ago or something like that. I think our
Where was it?
numbers, I don't remember, it was pre-COVID, but I think the number was even
I
higher.
think we're around 600.
Yeah, I thought we were
Yeah, I was
close
gonna
to
say,
that.
so it's come down in, 2 years or something like that. It's come down by almost 100, I think. Yeah, looking at those numbers. I guess I would just say that, I'm certainly supportive of extending the moratorium. But I guess I'm feeling like, I don't know if I want to keep allowing licenses and, new licenses and RRs right now, because I feel like we need to have a discussion of what are our caps and are we trying to, phase out them altogether, which is what the ballot measure was trying to do, or kind of what's our goal? So I'm supportive of extending the moratorium. I feel like we just need to think about, what our overall goal is with STRs, and if we should just extend this one temporarily, or we should go back to the one we had previously, which was no new licenses at all.
So I just want to remind the commissioners that you did pass 523, which
Mhm.
sets geographical areas. Those areas have caps. So that's just a consideration.
But you can always change the caps.
Yeah, you guys
Yeah.
determine how you want to set the caps, and that can, change and be adjusted.
I think that's another piece that we need to do before we
Mhm.
do open back up to set those caps.
Absolutely.
Right.
Yeah, because otherwise it's chaos, I think.
Right.
Yeah.
So what is the thoughts on a new moratorium that would go into effect, and how long? Or
Definitely, I'm hearing consensus for a new moratorium. And
I think 6 months.
6 months,
I would
You know,
say
maybe-
a minimum of 6
Yeah.
months, but
and if by some opportunity, some chance everything falls into place to begin implementation of 523 sooner, then we could always lift the moratorium. But, I know we've got a lot of business ahead in the coming months. And I think there's safety in 6 months.
Maybe I should ask the commissioner, what's your goal? When would you like to do this? I mean, we can spend 6 months and work towards that goal, obviously, but I mean, is there a time frame you would like to have this done? I mean, or 6 months, the time frame?
I'm just thinking we need to take as long as it takes to come up with a well thought out implementation plan. I don't want to necessarily, personally, from my standpoint, push for a deadline that maybe is difficult or
And I guess the
impossible
only
to
reason I
meet.
ask is, we extend 6 months and then,
Mhm.
we
Yeah.
don't work on it for 3 months.
Yeah.
And then start, pushing together. So I didn't know
Well,
if there was a desire
yeah.
to have something sooner, or if 6 months is the goal, then obviously we'll work towards that.
and that was why I indicated earlier, we could make it as long as we like and then revoke it.
Right. But that's why I didn't know if
When
there
it-
was
when it-
actually a date in mind that you were thinking of.
I think that staff needs to meet with planning. And so I know there are staffing issues that they were trying to bring another environmental health specialist on. And that needs to happen in order to make this program move forward. So maybe staff can meet with planning in the sheriff's office and then come back with a proposed timeline.
I would like to implement it sooner, but we have to hire a hearings officer. We need to stand up a septic program, which requires staff. And it's not just hiring the staff, it's training them and making sure everyone understands the rule, right,
Yeah.
all of that.
And as Lisa said, getting notice out to owners of
Yeah.
the new provisions.
Absolutely. So I would say if we extended to 6 months, that the goal would be at that time that we have everybody on board and everyone understands the rules, and we have our hearings officer, and our code person is kind of trained up on 523 and ready to go, and the pieces are ready to implement. Because I do think that there certainly is going to be some confusion and, you know, people are going to need, you know, a lot of hand holding and information and just making sure that internally, like, we got it, you know, we have it sort of ready and figure out so that we can have good communication and be clear about what we're doing. And I think it would take more than 90 days to do that.
Mhm.
You know, especially because we are having, you know, trouble hiring people right now, as is a lot of employers. So, you know, making sure we have the person from planning is pretty critical as well. So I think 6 months is more
Mhm.
realistic than 90 days would be.
So
Well, sorry to interrupt, Chair. Does staff, all staff that's present, i.e. council, administrator, sheriff's office, do you feel that 6 months is a reasonable period of time to implement this?
I know for our 6 months is good for us. Like I said, I
Okay.
think what's just described by Commissioner Jacobson, I think it's planning in the other areas that are going to
That's
kind of
why
become
I'm
is more needing the time than we are. Actually, as far as staffing for those positions, we are actually staffed for those positions now.
Yay.
Okay.
So maybe between now and next week when because state wise, we're okay. The 6th is not next week. So maybe Tim or Kristen, someone can have a conversation with Ano and see if the 6-month timeline is going to work for him on implementing septic stuff.
So the directive is extend the moratorium, extend it 6 months, and a directive to staff, develop an active plan and timeline for implementation of 523.
Sounds good to me.
I think we're all in agreement on that.
The commissioners from us, in order for you to set those caps, what do you need from us for statistical data that you would like to see or compare or anything?
Well, I think definitely, I haven't seen updated maps probably since before the ballot measure
Mhm.
of, you know,
There's
those
still
sound-
just the draft one from May of 2021.
Could that
okay,
be
so I
updated?
think we need updated ones.
Well, I've got the map as far as how the regions are set.
Yeah,
Mhm.
And then
And you have
um,
current numbers.
I
You want the
do
current
have current numbers also from surveyor's office,
according to
as
the
a-
regions.
according to our
Okay.
511 and based on what's in each region now. So I already
Okay,
have that.
so you got
ready
it.
to go.
Okay, yeah, I think that's kind of what I need.
And I believe when those maps were brought before us, there was some discussion of capping licenses at current levels in the 5 zones west of 101, and then allowing some growth in the zones east of 101. But I think, you know, we need to
think we
re-examine
need to-
that.
That is a general conversation.
I
Right,
think we
but
need
no
to have that
policy
talk.
decision was made. So yes, we definitely do. So just make sure we're clear on one other point. Do we want the next moratorium to be along the lines of the current moratorium, or go back to a complete prohibition of new licenses in all zones?
I guess
And-
I'd ask Connie, excuse me.
Okay.
Chair, I mean,
Yeah, I was just gonna say Commissioner Jacobson said she favors that option. I'm
I
not sure.
do.
I'd ask Connie Council, are there any legal aspects of going backwards?
So it's a policy decision on moving forward. Just to be clear, we have geographical areas set. It's not based on zoning for 523.
Right.
So 523 sets 7 geographical areas.
Areas,
Correct.
not zones.
Correct.
Mhm.
So the next extension, if you're proposing a 6-month extension in line with 523, and essentially it's giving you time to decide what caps you want. So the recommendation probably would to suspend licenses at this time until you make a decision on your caps. And
Well
that's a-
said. That's
a
what I support.
policy-
Yeah.
It's a policy
Okay.
choice.
That's fine.
I'm fine with that as well.
Sure.
Okay, have we covered all the ground we need to cover today on this subject? I think we
I
have.
think so.
Thank
Yeah,
you very
thank
much for your input.
Appreciate-
Oh, actually, I'm sorry. I do. have a
Okay,
question.
Commissioner.
Almost.
I got it in capital letters. I put a box around it and I even put a question mark by it. Talk about where we are as far as enforcement, I guess, in the future. I mean, I think one of the keys to the success of this ordinance is enforcement, because if I remember correctly, we now have it or will have in place an effective 3 strikes and you're out rule, which really was there, but ineffective. So I would be interested in where we're at as far as enforcement and expected 3 strikes you're out.
I think that's the
Policy.
key, is having that be the process set, which is wasn't really set before, and it kind of left it more on us, which, as you know, I didn't care for, as being the issuer and the judge basically on those. To have a procedural process to go through, I think is important. Like I mentioned, we have that position filled, so that person's actually in the process of getting trained up now. We'll be ready to go, obviously, in 6 months, and that's our intention, to follow that as it's intended to do. And the hearings officer will be hired and have that. I think everything's in place. I don't, obviously, there will probably be still some growing pains as we go through it, but I like the process as it's set, and ready to begin the enforcement of that.
Thank you.
May I add one thing?
Sure.
You can add 2 things.
Okay, so I honestly am less concerned about the current operators and active licenses, because we've had enough time now that they're getting more on board with requirements. And I think we have good plans for when there's violations and going through that hearing process. The harder piece is people that are operating unlicensed. That is really a hard one. Partly, and I'm hoping that 523 will help in the effect that we've put in place. They can't advertise and offer, in any way, shape, or form. They're limited by that. So because before it was just catching visitors at the residence, and then when we get into court, it was complicated, and it was really time consuming for us and our community services people, issuing citations to owners who live outside of our county and our state. It's time consuming. So I don't know what the right plan is for that, but we know that there are people operating under the wire, and bringing that into compliance is a little harder.
That's a good point. I mean, that's the enforcement
Okay.
piece that we've always done,
Mhm.
but it's been difficult to achieve and go through. And we know now, especially putting caps, we're going to see more and more of that come up.
Right.
All right.
So maybe that's something on the to-do list as we look at implementing
Mhm.
523, is really reviewing what that says about how we deal with that and trying to make sure that we have,
It's gonna come down to fines.
And even the fines, these owners are making money on this, so. I
so
mean,
what's
it's almost worth paying the
$150 fine or whatever?
Mhm.
We
and
just
making it,
amended
so.
the fine zone, which will be better. And we need to look at that fee structure this fall. So that's something.
Did you amend the 500,
We-
1,000?
Chapter 10,
Oh, okay.
but we also need to look at that.
So let's review that at some point.
So the fee structure will be looked at in the fall. So we're gonna be looking at licensing fees and also fines specifically for STR.
Okay, but does current ordinance 523 have language in it that would enable more effective enforcement of those short-term rentals that are operating without licenses?
It hasn't changed. I mean, it's the same enforcement as it was under the,
It's a citation
yeah, it's a citation.
under 10.
I don't know if there's anything else
Is
that
that,
can be done.
is that an effective tool?
Well,
Do you
Well,
need something
we're-
different?
I don't know what we need. It's.
even issuing the citation is difficult,
Right.
just, because all these people don't live here.
I think a while ago, we kind of did, I forget the vendor we used, but didn't we kind of have a sweep done with a third party that kind of went out and actively looked for those vendors that were advertising?
So basically, we have Muni Revs, Lodging Revs.
Yeah,
And they continue to scrape the web.
So
on a
they're still
regular
doing that,
basis,
okay.
Looking for those. So they come to us in always. Neighbors that are complaining, the vendor provides updates to properties that they're catching advertising again. All sorts of ways. And we do follow up. But it's hard because we've got to, I think 523 will help with the advertising piece, because it's easier to prove that they're advertising versus whether or not you've got renters on the property that admit that they are
mm-hmm.
and are willing to testify to such. Citing owners, in other states is complicated. Out of the country is impossible.
Excuse me. Yeah.
Bless you.
Well, I guess another question I have just in trying to deal with that, is there any reason legally why our code enforcement officer or Lisa or whoever couldn't book a reservation to someone we think is operating illegally and seeing if that would work?
I mean, there's lots of investigative aids
Yeah.
you can do and undercover STR operations.
Should we do a
Again, I mean, I think we get a lot of information on them and doing them. It's just that process and then
It's just the hammer.
making sure it holds, yeah. I think
Yeah,
That's more
okay.
than the issue than finding them. I think we have a lot of methods to find them.
Okay, so it sounds like we need more discussions on
That'd be a fun
Add
way
that
to
to
do
the
it.
list.
That would
Yeah.
be
Yeah,
team building.
Yeah. we can do
Yeah.
that.
okay.
So
I
are you
think
bringing
there's
this back next week
consensus.
for a decision action.
Yes, please.
Works for me.
Thanks very much.
Thank you.
We move on now to reports. First up, commissioner reports. I don't have anything to share today. How about my colleagues?
I am headed up after this meeting to go to Lincoln City and participate in the groundbreaking ceremony for Habitat for Humanity to 2 pieces of property that they will be building homes on for local residents. And those are 2 pieces of property that we donated to them that came in a tax foreclosure many years ago. And it was kind of one of the first things I think we did as a board when I became a commissioner. And so they are breaking ground and moving forward. And it's very excited
Yeah.
to see our donation kind of start coming to fruition. So it's
Wonderful.
exciting.
And that's
Yeah.
within the city proper, you know,
Yep.
because people have heard the publicity about our most recent donation to Habitat of a building lot on Highway 18 in the Otis area. But
Yeah.
this is now bricks and mortar work beginning on the other sites we donated a few years ago.
Yeah, and
Nice.
there's 2 other sites. 2 we donated to the Confederated Tribe of Siletz Indians, and then we also donated 1 to Northwest Coastal Housing, and have emails into both of those entities to see where they are at
Mhm.
and developing those projects. But it's great to see Habitats moving forward. Yeah.
Amen. Anything else?
Nope.
Commissioner Hunt.
Yeah, well, certainly those steps being taken are, I guess, the same as how do you eat an elephant? One bite at a time. Housing project is a huge problem, and those small steps are good steps in the right direction. So good work there. Couple of things. I'll just note that yesterday, shout out to the M team. The Board of Commissioners, Commissioner Jacobson was absent, but I'm on other county business. We heard from 3 different groups that were really, I think, visionary or forward thinking as far as areas of how to do a better job of recruiting, hiring, and retaining employees. Second group talked about the budget and how we can be more transparent and prepare a budget document that is readily understood by our citizens. And the third area was possible avenues or methods through which revenues could be enhanced through activities of the county. So I thought that was a great day. Lots of work to be done, and we'll look forward to hearing a follow-up report from Mr. Johnson. And then I'll also mention this because I think it's very important. The second phase or the second time of mandatory training for supervisors will be this Thursday. And again, I think that's a good step in giving our employees the skills to be more effective and provide better service to our citizens. So those are a couple of things that I think are noteworthy.
Thank you, Commissioner Hunt. And now under reports, we have our monthly COVID-19 report from our Public Health Director, Florence Portel. Florence, are you ready to go?
Yes, good morning, everybody.
Good morning.
Good to be with you. Okay, so we can go to the next slide already. And I'm just hoping that this is the slide deck. Yeah, this is a slide deck from this morning. Thank you. So a few main updates. This is going to be a little bit shorter than usual. You know, as you know, COVID-19 has been endemic for a few months now in our country, state and county. And what that means is that we are seeing a continuous presence of the virus and the disease it creates. And so I just want to make sure that people understand, we had a moment, I think a few months ago or 6 months ago, when we thought, oh, COVID is over. Well, it's not. And it is there to stay. And this is a virus that is extremely good at adapting and replicating. And it seems like it's getting better as we go through this COVID experience. So main point, this is not over. Second main point, the numbers that we are seeing, as we've discussed before, do not reflect the volume of actual cases happening in the country, the state, and the county. And the reason for that is that those numbers are based on the reports of cases we're getting. So when a lab does a test, they are required by law to report the results of that test to the public health departments from where the person who tested positive live. As you know, there are a lot of people who are taking their tests at home and do not report the results to the health department. So, the in quote, seemingly low numbers in cases are not a true representation of what is actually happening. Next
So
slide, please.
Florence,
Yeah.
if I may interrupt before you move on, I think it would be helpful, particularly for people that may be viewing this virtually. Explain the difference between a pandemic and an epidemic.
Or endemic.
That's
Well,
All three. Explain all three.
Okay, all three.
oh boy, thanks. So there is a lot of debate actually as to what's a pandemic and should have we said right away that this virus would be endemic. So endemic is what I was trying to discuss.
Florence, I can't hear you. I'm sorry.
Yeah, if you could get a little closer to your microphone, you've kind of started fading out. Thank
No,
you.
I think it's my phone, my microphone just turned its
There you
volume
go.
down. Okay,
That's
sorry.
good.
All right, so what I was saying is that there is quite a bit of debate on those definitions. Endemic means that a disease is now established in a community, right? And that there is a continuous presence for that disease. A pandemic is and maybe I should start with epidemic. So an epidemic is when you have an explosion of little outbreaks in a population. A pandemic and in a geographic location. A pandemic is an epidemic at the global level. Does that make sense?
Yep.
So
Thank you.
endemic just means that even though we've done so much work to try to contain the spread of COVID and its constant evolutions, the virus has been faster than us, right? And we have not succeeded in this containment. And also, I think because of the fact that this is a pandemic, if we're making some efforts in the privileged countries in the world, right? Like to get vaccinated, but then we are not deploying the same vaccines and efforts to other parts of the world, then the virus can, create new variants that we've seen very well with Delta out of India and then with Omicron out of South Africa, because we are such a connected global network. If the epidemic is not taken care of in South Africa, for example, because let's say there is not as much access to the early vaccine as we've had, then there is no way to contain that epidemic, and that epidemic is going to then spread everywhere else, because we're so connected with airplanes and things like that. Does that make sense?
Yes.
Okay.
Thank you.
Yeah, you're so very welcome. Okay, next slide, please. Okay, so how do I start this? As you have realized during the Omicron surge in January this year, the initial vaccines that we have been able to receive in the US, where they had been developed based on the initial variant of COVID. So the one that was identified in China, in Wuhan province in 2019, okay? And as we've talked about, the virus has been changing and evolving. So even though those initial vaccines were really, really good at protecting people against getting infected by the virus at the time, with Omicron, two things happened. One, most of those protections were starting to wane out of folks' bodies because they had gotten the vaccine about 4 to 6 months prior to Omicron hitting. And then because Omicron is such a good variant, it was also extremely good at passing through the antibodies that had been developed by the previous vaccine. And so what has been done since Omicron is that the Pfizer and Moderna companies have been working on adding the variant BA.5, so Omicron, and one of the latest version of Omicron, to the original variant. So this is why it's called bivalent, because there are two different variants that those vaccines are targeting. So what the scientific community and the public health community is hopeful for is a vaccine that is going to be better at protecting than the original vaccine, especially when it comes to the current variant of Omicron and the variants that we're likely going to see in the future. And the other good news is that from the data that has been shared, those vaccines are at least as effective as the original vaccine, which is a very good news because the original vaccine, as you may remember, were extremely effective against infection. So what I learned this morning is that unfortunately at this time, this booster, so let me just recap before I go there. So this is going to be a booster which means that only the folks who have received the primary series of the vaccine, so the 2 initial doses, are going to be eligible for this booster. And then it is anticipated that the Pfizer bivalent booster is going to be available for at least for the 12 years old and older. And Moderna bivalent booster is going to be available for the 18 and older. But this is a maybe, because those 2 companies just submitted their emergency authorization use applications to the FDA yesterday. And so we'll have to see what the FDA goes with. Lastly, what I was reading this morning is that, as you know, this, I mean, we say it's free, but as you know, those vaccines have been available to all at no cost to an individual. Apparently, this is going to be the last time that this is going to be possible. And the reason for that is that there is no more COVID funding available, and none additional has been made available at this time to be able to continue offering these COVID vaccines free of charge to the American people. I'm going to stop here. That was a lot of information. Maybe go to the next slide. Okay, and the last piece is, I know everybody has questions. We do too. So we do not have any guidance at this time because the FDA has not made any decision on those bivalent boosters. And then, as you may remember, after the FDA, even if the FDA approves those, then it has to go to the advisory committee on immunization practices from the CDC. And then if the CDC approves, then it goes to the Western Work Group on Immunization. And then when this is approved, it goes to the Oregon Governor's Office, and then down to OHA, and then we're going to get our guidance. So it's going to be a little while. It seems that people are anticipating it to be available soonish. We've received from the Oregon Health Authority some pre-order opportunities. So we've pre-ordered 300 doses of Pfizer bivalent booster and 100 of the Moderna version. We don't know yet when we're going to receive any of those. So it's kind of all in a, we're in a waiting pattern. And in the meantime, we are working and planning for who to vaccinate and how to do that, and when to do it. So, you know, if you remember at the very beginning of the availability of vaccines, the folks that were in the early eligibility phases were people who lived in long-term care facilities. There were the congregate settings. There were a few different targeted groups based on kind of their vulnerabilities. So we're definitely planning around making sure that those folks are taken care of. And then once we have more vaccine available, we'll continue on with our outreach and mobile clinic system. And obviously, we will communicate with everyone to let them know of when those schedules are going to be scheduled and where we're going to be at. One thing of note is, as I mentioned, I think last time I was with you, is that, you know, our volunteers, we've been relying on volunteers so much through this pandemic and especially through the vaccination efforts. You know, our volunteers are kind of dwindling down a little bit. And so what is great is that we're gonna get some workforce augmentation through a contract with the Oregon Health Authority that I just saw in my mailbox this morning. And they also have their mobile clinics through FEMA that they are willing to bring to Lincoln County again to assist us with vaccination. So that's pretty exciting that we do not have to worry about having to handle this only through our local volunteers.
Florence, I have a question. Do you have a list of our sort of like active volunteers that have been helping with these efforts?
Yeah, we do. Mhm.
I
I don't have
maybe-
it in front of me.
No, that's okay. I was just thinking about our earlier offer to Keith and, you know, sending out a letter to those partners, and maybe we can do something similar to all of those volunteers and send them a formal thank you letter from all of us just for their
Yeah,
continued efforts on making those work.
I
So
think
maybe
that would be
we can-
wonderful. We had done a publication in the newspaper, I believe, like a while back, but I think that would be really great to do that.
Okay, yeah, if you could follow up and send us a
Yeah,
list of people, that would be great.
it's a lot of people. Any other questions before I move to the data? I mean, I don't know if you wanted me to go through the data. It's just a few slides. But like I discussed earlier, it's not necessarily representative of what's going on. But what we can see is that, you know, we've had plenty of COVID cases over the summer. It seems to be, we seem to see a downward trends in terms of, you know, daily infections at the state level. Next slide. Similar trend in Lincoln County, kind of a surge this summer, and we seem to be having less cases. Our positivity rate is 5 times what we were striving for, remember, in 2020 and 2021. So there is plenty of community transmission happening in the community. Next slide.
So Florence,
Mhm.
maybe this is a morbid question, but I see there've been 102 deaths in Lincoln County. Have there been any recently, or what's the trend there been?
I will have to get back to you with this. I don't know about the recent. I think we might have had 2 that I know of that have happened in the last few weeks. What I can say is that we've definitely had the highest level of hospitalizations locally than we've ever had since the start of this pandemic. At some point, we had 7 people in the hospital with COVID-19 between North Lincoln and Pacific communities. We've never been that high, but per Dr. Ogden's, it seems that the length of stay for those folks is not as long as it used to be. So, but I can follow up on the death.
I'd appreciate that. Thank you.
All right, so this is our comparison from year to year. We are in the yellow year. So that's interesting to see that our 2021 Delta surge, we can see it, and this is the August red bar for 2021, August and September. You know, overall, this year is the worst year in terms of COVID transmission and cases, even though underreported to the system. Next slide.
Is this for Lincoln County? I assume that last
Yes,
chart.
yeah, Lincoln
Thank
County.
you.
Mhm. And then this is the current vaccination. You know, I think overall we did such a good job, and 81.1% of the eligible folks have been vaccinated in Lincoln County. You know, the booster uptick is not as good as it could be, but I'm hoping that with the bivalent booster, we'll be able to do a better job. Next slide. And those are the vaccination clinics we have currently planned for the remainder of this month in September. As you can see, we are still present throughout the county, and we're gonna keep on doing this until we can't do it anymore because we ran out of money. But for now, we have plenty of funding left. Next slide. Okay, so those are the same kind of slides that I've put forward before. COVID is not over. It's definitely active. This is a great adapting virus. The symptoms are on the slide. Recommendation has remained the same. If you're sick, please stay home and wait until your symptoms resolve. There is this recommendation to wear a mask indoors. And about testing, especially if you use an at-home test, it's very important to time your testing well. So it's recommended that as soon as you're experiencing some symptoms that could be COVID symptoms, you test. And it's not because your results going to be negative at that time. Try the next day when you have a little bit more symptoms, test again and see if it pops positive this time. And remember that it's not because you have a negative result that you do not have COVID. Next slide. Okay, I'm going to pause before I go to flu. Any questions on COVID?
No, I think we've covered them.
I just might note that the vaccination clinic will be held at the Walport Community, the community center, but what about the new Walport Clinic that's opening, I believe, Thursday?
We will be there. It's on the list. Walport
Okay.
Community Clinic on the 1st of September.
Oh, yeah, well, I'm sorry.
No, don't
Okay.
be sorry. And
Good.
we'll have tests
I think that's
also.
important.
Yeah, we'll also have COVID testing for those who are interested.
Okay, good.
Any other questions?
None for me.
None for me.
I'm done.
Okay. Okay, so I know you had some questions about flu. So here's what's going on. We have a few flu clinics scheduled for Lincoln County employees on September 29 and September 30th. And we also are awaiting, I think, 500 doses of flu vaccine for the most vulnerable populations in our community. So we're going to keep on using the model of outreach and mobile clinics and possibly just add the flu to those COVID clinics. So we're going to go and work with a lot of partners to reach out to our most vulnerable. And then the other piece we're working on is making sure that the vaccines are going to be made available throughout, right? So I know we have a few clinics scheduled for Newport already. I don't have the dates yet. We have one that is going to be scheduled in Lincoln City. We have one that is going to be scheduled in Yahat and another one, I believe, in Walport. As soon as we have the dates, we will let you know and communicate around this. But yeah, we're working on this. That's what I have.
All right, thank you very much, Florence. Any further comments or questions on our COVID report for this month?
Well, I guess kind of a discussion point I have, I think it might have been Kelly or Chelsea or somebody that was asking me is, do we, now that we're kind of in this endemic state and it's not going away, do we want to continue to have these updates every month? Or I think Florence had offered to kind of do stuff beyond just COVID, or, do we want to keep doing these?
I don't know. I still think the monthly report is helpful. But I'm open to going to a lesser frequency if that's the consensus.
Well, I think maybe monthly reports, but you can tailor them to the particulars that have occurred in the interim period.
Sure.
Yeah, and I mean, I'm okay with doing monthly report, but the thing I'm finding is because so many people now, as Florence brought up, test at home and don't report, the numbers aren't necessarily accurate on
Right.
what is really happening. So I don't find that the data is maybe as accurate or beneficial as it used to be, just because of, of that factor. But I'm fine with maybe doing a more condensed version of the report every month that again just kind of talks about what Commissioner Hunt said, which is where are we from last month? Are we still seeing hospitalizations go up? Are we down? I think that
Okay.
would be helpful.
I would agree with that.
I'm fine with that.
All right. Thank you, Florence.
Thank
and
you.
We'll see you
Good job,
next time.
Florence. Thank you.
Thank you.
Yeah, you're welcome. Bye.
All right, we move to the time for public comment. If anybody on the Zoom call would like to offer public comment, use the raise your hand button, please. And Mr. Miller, did we receive any smart sheet input since our last meeting?
We did not.
Do we have anybody in the room signed up for public comment?
We do not.
Okay, seeing any hands on Zoom?
No, it doesn't look like it.
All right, then we are at the end of the meeting, and our next two Board of Commissioners meetings, both will be beginning at 10 a.m., both in this room, the Commissioners Conference Room, but a Zoom option available for attendance as well. The office staff meeting on Monday, the 29th, and the regular Board of Commissioners Public Business meeting on Wednesday, the 31st.